Hello everyone, and welcome to today's presentation. I'm excited to have you here as we explore the anatomy of the respiratory system. The title of our session is Respiratory System Anatomy, and it's part of our Visu online training series. In this presentation, we'll take a closer look at the key structures involved in breathing, starting from the nose and pharynx all the way down to the alveoli and diaphragm. We'll cover the nose, pharynx, and larynx, then move on to the trachea and bronchi, followed by the lungs and their lobes. We'll also discuss the alveoli as the gas exchange units and finish with the diaphragm, the main muscle of respiration. So let's get started and dive into the fascinating world of respiratory anatomy. Let's dive into the physiology of respiration by exploring the key processes involved. First, ventilation, which includes both inspiration and expiration, is how we move air in and out of our lungs. Inspiration brings in oxygen, while expiration expels carbon dioxide. These movements are essential for maintaining the proper gas exchange. Next, we have external respiration, also known as alveolar gas exchange. This is where oxygen from the alveoli diffuses into the blood, and carbon dioxide leaves the blood to be exhaled. It's a critical step that ensures oxygen enters our bloodstream and carbon dioxide is removed efficiently. Following that, internal respiration occurs at the tissue level. Here, oxygen within the blood diffuses into the tissues, and carbon dioxide produced by cells moves back into the blood for removal. This continuous exchange sustains cellular function. Oxygen transport via hemoglobin is another vital component. Hemoglobin molecules in red blood cells bind oxygen, allowing for efficient transport from the lungs to tissues throughout the body. This process is highly adaptable and responsive to the body's needs. Finally, respiration regulation is controlled by the medulla oblongata and pons in the brainstem. These areas monitor levels of carbon dioxide and oxygen in the blood, adjusting the rate and depth of breathing accordingly to maintain homeostasis. Understanding these interconnected processes helps us appreciate how our respiratory system supports life, ensuring tissues receive the oxygen they need and waste gases are properly eliminated. Let's take a look at the diagnostics involved in pneumonia cases. Typically, we start with a chest X-ray, which helps us visualize the lungs and confirm the presence of an infection. Along with that, a complete blood count, or CBC, is important to check for signs of infection or inflammation. We also rely on sputum culture to identify the specific organism causing the pneumonia, which is crucial for targeted treatment. Moving on to treatment, antibiotics are the mainstay. They fight the bacterial infection directly. Oxygen therapy may also be necessary if the patient has difficulty breathing or low oxygen levels, ensuring they get enough oxygen to support their recovery. When it comes to coding, it's important to note that we should specify the organism if it has been documented. This helps in accurately classifying the case and ensuring proper reimbursement and reporting. And finally, the ICD-10 code for pneumonia is J189, which is used when the specific organism isn't identified. Remember, proper documentation and coding are vital for quality patient care and compliance. This slide ties into the overall theme of understanding pneumonia management, from diagnosis and treatment to accurate coding and documentation. Let's talk about diagnostics first. Spirometry and peak flow measurement are essential tools for assessing asthma. Spirometry helps us evaluate lung function by measuring airflow, while peak flow gives a quick estimate of airway obstruction. Both are crucial for confirming the diagnosis and monitoring disease severity over time. Moving on to treatment, bronchodilators are often the first line of defense. They relax airway muscles and provide quick relief. Inhaled corticosteroids, on the other hand, are used for long-term control. They reduce inflammation and help prevent exacerbations. Now, regarding coding guidelines, it's important to note that we use the 5th or 6th character to indicate the severity of asthma. This helps ensure accurate documentation and appropriate management. And finally, for coding, The specific ICD-10 code for asthma is J45909, which is used for unspecified asthma. Remember, understanding these diagnostic tools, treatments, and coding practices is key to providing comprehensive and effective asthma care. Now, let's look at the diagnostics involved in managing COPD. One of the key tools we use is the pulmonary function test, or PFT. This test helps us assess how well the lungs are functioning and can guide our treatment decisions. Speaking of treatment, the main options include bronchodilators to open up the airways, steroids to reduce inflammation, and oxygen therapy for those with significant oxygen needs. These treatments aim to improve breathing and quality of life for our patients. When it comes to coding, it's important to remember that we should code an acute exacerbation separately, using the specific code J441. For COPD itself, the ICD-10 code is J449. Proper coding ensures accurate documentation and reimbursement. This slide highlights critical steps in diagnosing and managing COPD effectively, emphasizing the importance of proper testing, treatment, and coding. All of these elements are essential parts of comprehensive patient care. Now, let's talk about diagnostics first. When we're evaluating a suspected tuberculosis case, we rely on several key tools. Sputum AFB tests are crucial because they help us identify acid-fast bacilli directly from the patient's sputum. The Gene Expert is a powerful molecular test that not only detects TB bacteria, but also checks for rifampicin resistance, which is vital for guiding treatment. Additionally, a chest X-ray provides us with a visual assessment of lung involvement, helping us confirm the diagnosis and rule out other conditions. Moving on to treatment, the mainstay is anti-TB therapy, or ATT. It's essential to start the right combination of drugs promptly to ensure effective treatment and prevent resistance. Now, regarding coding guidelines, when documenting TB cases, remember to use the appropriate fourth character to specify the site of the disease. For example, the ICD-10 code for tuberculosis of the lungs is. Proper coding not only ensures accurate record-keeping, but also influences reporting and resource allocation. All these points tie back to the overall goal of accurate diagnosis, effective treatment, and proper documentation to improve patient outcomes and public health management.